like to call to order the Special Comment Council meeting for November 1st, 2022 at 5:46 p.m. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Attendance roll call.
Alderpersons Wolf.
Here.
Hamel.
Here.
Terrence.
Here.
Kapusta's absent. Schrader.
Here.
Kubaki.
Here.
And Madden.
Here.
We have a quorum present.
Thank you. Statement of public notice.
The meeting was noticed in accordance with the open meeting law.
Thank you. There is no communications from the mayor's office. New business. I'm going to take these out of order because they'll make sense at the end when I'm why. So the first one will be discussion and possible action on selection of an employee health insurance carrier. In front of you, I provided you guys with a memo, which I'll just read off of to kind of explain where we are at and how we got there. So as you are aware, we have been investigating options for health insurance providers to save money. Indications from industry experts were leaning towards a significant savings by switching to a different provider in the marketplace. One of the main reasons is several providers in this area, such as United Healthcare and Humana, have much stronger discounted service agreements with major healthcare networks in the area, such as ProHealth, Aurora, Freighter, etc., than WPS does. These agreements should provide a significant savings. However, when our healthcare consultant, Cottingham and Butler, went out to the market with our business, they were running into concerns from the major providers because of our lack of detailed claims data. Simply, most didn't feel comfortable quoting without this information, and I'll add, we're erring on the side of caution. In the end, we were left with these three options. Option one would be to continue with WPS and see what they offered for a renewal rate on July 1st. WPS did provide a bid for changing our renewal rate to January 1st, as that is ultimately our goal, is to have our plan mirror our budget year. And their bid for changing it to January 1st included a 8.5% increase over our current rates. I would anticipate if we waited till July 1st renewal, it would be at least the same or more if we waited till the end of our contract running out for July 1st. Option two would be to move to the state plan, EFT. Again, I'll go off script here a little bit. The state plan is state employees, numerous counties, and other municipalities and towns can join this plan. So it's a large pool. This plan does offer an approximate savings of about $37,000 this year over what we're paying for WPS. And that's even after they kind of assess a surcharge based on what their risk tolerance is. Since we had no data coming in, they assessed their maximum, which is 40% to their premiums. So it's a 40% surcharge tacking on to the rates because of our lack of data. The following year, that surcharge would drop in half, providing about a $300,000 savings. And in year three, it drops off altogether, providing about a $600,000 savings. Now, that's not taking into account each of those subsequent years. There probably would be some plan increase that we could maybe figure a 5% increase in the plan, but that would still be a significant savings and for years 2 and 3, but almost nothing year 1. The ETF plan does offer good health insurance plans, but they do not offer a plan that has both ProHealth and Freighter networks in any of their plans. In addition, WPS currently offers 3 levels of coverage: single, family limited, and family. The ETF only offers 2 levels, single and family. Those in the family limited would be migrated into the family plan, costing them more out of pocket than they are currently paying. With this plan, a number of employees will also need to find new doctors and medical providers, which can be a large disruption to those affected. Mainly if you have your kids at seeing a pediatrician at Children's and you have your personal through either Freighted or something, if you're at ProHealth, you more than likely with the state plan, while it's good insurance, you more than likely would, not more than likely, a number of our employees would have to find new doctors, which is a disruption. Option 3, United Healthcare has offered to provide coverage which is nearly identical coverage to WPS, what we're currently offering in the statewide plan, which is the better of the 2 plan levels we are offering. 62 of our 83 employees are currently using that upper plan, which is called statewide plan. And really the main difference between the statewide plan and the lower plan is the Medical College of Wisconsin, meaning Freighter, Children's, and all that is in that plan. With this option, all employees would be on that plan since they only offered that one plan. UHC would also provide us with monthly claims data, which should give us the information we need going forward to get competitive pricing for future contracts, either from United Healthcare or other providers. So knowing those 3 options, my recommendation is to go with United Healthcare for the 2023 plan year. I present this for the following reasons. Number 1, United Healthcare, WPS, and the state plan are all priced similarly for 2023 year. United Healthcare and ETF actually are less expensive because their contract price is locked in through the end of the year, where WPS is only locked in until the end of June, at which rate we would more than likely see a rate increase, specifically since they already offered us an 8.5% increase before then. United Healthcare offers a plan that is nearly identical to what our current employees are used to and offers the least disruption while gaining all important access to claims data on a monthly detailed basis. Number 3, after 1 year of claims data, we are hopeful that United Healthcare will offer a plan that will provide a significant savings as we were expecting from the beginning. If they do not, we could move to the state plan, but with 1 year's worth of data, we would anticipate the surcharge from the state plan to be at least half of that 40% that they were quoting. So it would be similar to like if we went to with them now where they go 40, 20, 0. If we go with somebody else for a year, have that claims data, and then go to them, I wouldn't expect more than a 20%, if even lower, surcharge. So we're not any worse off by waiting to go to them if we need to. And it would put us in no worse condition, as I said here. And that which would allow us to set us up for significant savings in the future, but not this year. Finally, to keep employees whole for 2023, I'm asking to keep the employees' premium co-pays the same dollar amount as what they are paying this year for their WPS coverage versus paying a percentage of the premium. This will protect employees who have opted for the lower WPS coverage, the non-statewide plan, that is because they're going to be forced onto a more expensive plan and a higher percentage. So it forces them onto that. It keeps them whole, so their out-of-pocket cost is the same. This is assuming that they stay with the same level of coverage that they have now, meaning if they have single now, they got to stay in single. If they if they have limited family, they would stay in that or family. If they opt to change one of those, they would pay that dollar amount that one of their coworkers are paying for that exact plan. So we would keep it that. This would have a minimum impact on our budget, but one that can be absorbed in our already council-approved tax levy. We can have discussion, but if you do agree with this, what I would need from you tonight is a motion to allow the mayor to enter into an agreement with United Healthcare to be our insurance provider for the 2023 budget year and keep employee premiums co-pays at their current dollar amounts as they are paying now. Discussion.
First, I'll make that motion.
Okay.
Second.
Discussion. Everyone okay with this?
Well, the only thing I was going to say is that United is the one you suggest, but if we wait a year, that pushes back just point this out, the $300,000 savings of the EFT or the state plan.
It does.
And then the second year would be 600,000. So
Yeah.
there's nothing really telling us what would happen with United. I mean, we might have to wait a year and then we could lose a lot of
So
savings.
there is a risk, I could say, of not jumping on the state plan now. The experts in the field, meaning our consultants and people who have gone through this, and the state actually has told us, as the state plan told us, the reason we're getting a 40% surcharge is because we have no data to provide
Right.
them. So they're assuming a worst case scenario. Our claims data isn't that bad from what we can gather so far. It's, so what the thought is, if we have 1 year of data, we can go to the state, here's our data. They may assess to 40%. It's unlikely. Most likely, they're going to end up at no more than 20%, which would put us where we were as if we went with them. So we still have that opportunity to have that savings with one less year of disruption to our employees and giving us more time to.
Okay, I just wanted to point out the numbers in there. The other thing I have is that our current plan, or the current plan is good, it's to a half a year? It's a half a year, right?
Our current plans run July to June 30th.
So if we switch in January 1st, then everybody only has a half a year insurance and they have to start over again, which is.
No, if we move January 1st, we're going to move our plans now from January.
Right, but everybody
calendar year.
that's in the plan now with their deductibles and stuff, they kind of lose all that half a year. So kind of keeping it the same is not, with going with the United Healthcare is not a bad option. At least it kind of helps buffer the transition is what I'm looking at.
Yeah, you do lose that deductible part of it, but we do have that not HSA, HRA, whatever, the reimbursables that we have as a backup on there. So their premium out-of-pocket cost isn't that much. It's like $250 regardless.
And the real risk is if our data comes in poor,
Yeah.
we could be looking at some significant increases.
The worst case scenario, we would be back 1 year from where we are now, meaning that the state would look at our data, say it's so horrible, we're going to keep you at that 40%. And then the following year, it's automatically 20. It just gets halved the following year and dropped the third year because of the way that the contract's written with this for the state thing. So that is the worst case scenario. It's an unlikely scenario, but that's where we're at.
So
I think it's worth the risk, actually.
So is our data, since we're requesting it, we don't have to release it to other people then?
No, that's private. I mean, and the data we get doesn't have names on it. So even though we're going to get names, I mean, we're going to get like, okay, there
Statistics,
was,
yeah.
it's statistic, it follows all the HIPAA rules and all that. So no one's private information is going to be shared with even us. But the insurance companies would have the types of claims and what our history is as a group. Everyone okay with this? All right. Yep. All those in favor say aye.
Aye.
Opposed? Thank you. And then the last thing we need to do is, a couple of weeks ago, I had a special meeting so we could actually get the state to quote us.
What else on this?
And since we're not going with the state, we need to rescind that one. So I'll be looking for a motion to rescind resolution 2022 approval for inclusion under the Wisconsin Public Employers Group Health Insurance Program.
I make a motion.
Second.
Discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? That's passed unanimously. Motion to adjourn would be in order.
So moved.
Second.
All those in favor say aye.
Aye.
Opposed? We're adjourned at 6 p.m. Thank you, everyone. Thanks for coming out.